now. Back again. Another installment. You excited, Josh?
I can hardly restrain myself, as always.
That doesn't seem legitimate. Come on.
It's totally legit. everything I say is legitimate. That's why we're famous.
Yeah, we're
going up against the presidential debate tonight. I think that our ratings will probably do better than the NFL. I don't know if you've been paying attention, but their ratings have been going down.
Yeah,
their content is not as riveting as ours.
And so we have made $14. We've made $14 on YouTube so far. So
you gotta stop spreading that around. I don't want people coming to my house trying to rob me.
Yeah.
Okay.
Well, I got the money, so
that's a good point. But they don't. Well, actually, now they do know that. So if I were you, I'd be careful giving out your address.
Yeah. Got my head on a swivel now.
We are live on the internet.
We are.
All right, so episode 38 tonight we have, I think, a very special show, which I'm very excited about. We're very happy to welcome two people from Tufts Medical Center, which is the teaching hospital for Tufts University. Megan Whitmore, who is a master physical therapist, on your right. Maybe you can wave just in case I'm wrong. That's Megan. The one who's waving is Megan. And Lisa Klinkenberg, who is also a physical therapist assistant. And I've been lucky enough to be treated by both of these people, and they're amazing. And I asked them to come on the show, and amazingly they said yes. So I got a whole bunch of questions from you guys already lined up, but definitely feel free to chime in at any time with any arm wrestling injury or recovery questions that you might have. So welcome, guys.
Thanks. You. Thanks for having us.
Yeah, definitely thanks for coming on. That's for sure. It's something that we very rarely get an opportunity to do as arm wrestlers. Is actually, like I said on the show before, I'm really good at breaking my body. I'm not really great at fixing it. So this is kind of a good idea. For me, I'm kind of selfishly going to be absorbing all this too. So thank you for coming on.
Absolutely.
That makes you no different from any of our other patients, by the way.
Exactly.
So have you guys arm wrestled in the office, first of all, just to figure out who's the champion?
We did not, but apparently yesterday when you're in the office, Lisa took a picture of you and I in an arm wrestling hold, and there was a debate as to who would have actually won that arm wrestling competition.
You totally would have beaten me yesterday because my arms hurt so much from the stupid world championship that I went to 2 weeks ago. I can hardly hold up a teacup. So.
My money was on Megan anyway, even if that wasn't the case.
Yeah, let's not pretend, Josh. Come on.
Hey, I have to maintain a little dignity. I mean, we're only 2 minutes into the show, so.
Yeah, it's supposed to be a slow downward slope. It's not supposed to just go crashing straight down.
All right, so how about some questions? Let's see here. What should we do first here? Okay, all right. Wilkerson, who is somebody I train with frequently, has been dealing with what he thinks this is going to be a common complaint, medial epicondylitis. Anyway, in his right arm, he has severe pain around his elbow that particularly bothers him in hook position, which I showed you guys yesterday. So when he's pulling across the table this way, he's feeling like what he describes as exploding pain in his elbow. He's had it for a year, so he's curious if there's anything that you might suggest. And once again, go see a physical therapist, Wilkerson, after you listen to the advice of these two women. But
this is probably true, or your physician as well.
Yes.
So I guess it could be a couple of things. It very possibly could be some medial epicondylitis. Definitely with the torque that's placed on the elbow when arm wrestling, one of the things we get a little bit concerned about is a ligament strain, so an ulnar collateral ligament strain, which really doesn't get better, potentially doesn't get better unless you have surgery, but definitely doesn't get better unless you rest it as well. So if it is medial epicondylitis, there definitely are some things you can do for it. Stretching is probably something that's maybe overlooked a little bit. But
yes.
John nods guiltily in the background.
On the inside of this elbow, if it really is pain pretty localized here on the inside of the elbow, one thing you can do is making sure your elbow's straight and extending your wrist to actually stretch the muscle belly that attaches on the inside of this elbow. Anytime you're stretching, you really should hold for a good 20 or 30 seconds in order to get some true muscle lengthening. Doing that 2 or 3 times, several times a day, is definitely a good start for that medial elbow pain.
Mm-hmm. So, what should they, if that was going to start working, what would they notice? What differences would they notice in their arm?
Probably, honestly, still going to notice the pain. The pain's not going to go away without some rest. What you should notice is a stretching here, not even necessarily where you have the pain at the elbow. The reason you have the pain at the elbow with medial epicondylitis is all those muscle fibers are converging into a tendon, and they're all attaching at one point. So if you're feeling a stretch in the forearm, that's actually a good thing versus pain at your elbow here. You may notice some increased range of motion into this wrist extension position as you do the stretch over a few days, but definitely some decrease in symptoms.
Okay. So I got a bunch of people asking questions about exactly what you're saying, and one of them, Alexander, is also involved in physical therapy, and he's curious about eccentric exercises for the epicondylasia of the elbow.
Absolutely. So there's a lot of different things that we try for medial and lateral epicondylitis. Stretching is always a good first start. Some manual therapy, some massage of those muscle bellies, and then absolutely eccentric strengthening. There's been a lot of research and evidence. Most of it's actually been in the Achilles tendon, but where the research has been, but really supporting some low load, high repetition, eccentric strengthening. So for medial epicondylitis, what that means, let's see. I have some household items that you could use, actually.
Awesome.
Props.
So I have a hammer.
Oh, don't don't do it.
So
Let's have actually Lisa maybe demonstrate.
okay.
So for medial epicondylitis, here, go ahead and turn over this way. Assisting yourself, you can do this with a dumbbell too, you don't have to do it with a hammer. But assisting yourself into this wrist flexion and then slowly lowering down into wrist extension.
Mm-hmm.
These exercises, most of the exercises we'll show you are extremely boring, but they're really effective. So something as light as a hammer, even for people who, like you guys, who are lifting lots of weights, for other muscle groups, for these small muscle groups, like the wrist flexors and wrist extensors, you really do want a low load and high repetition. So we're talking 30, 40, 50 of these, maybe 3 sets of that, 2 or 3 times a day.
Mm-hmm.
Okay.
And that's the hardest part of all of this, especially for athletes, is to get them to back off of the level that they're used to working at. So we hear about this goal of, 150, 170, 190 pound curls. And this is the pinnacle of athletic success in this particular sport. So backing off to something like 5 pounds, 7 pounds, 10 pounds is really a mental obstacle to overcome. But it's the only thing that's going to get into that recovery phase that is going to solve that problem.
Mm-hmm.
Yeah, I can attest for myself. A couple years ago, I had a pretty bad injury right here in my hand, right on that inside area here. I had a slight fracture and a pretty bad tear. And of course, I didn't go to a doctor for months, 9 months. And then when I finally went there, they were like, what are you doing, right? So they actually prescribed pretty much the same thing you just said, which is the stretching, active stretching. Make sure I really warmed it up first, because as he told me, on the underneath here we're way overdeveloped, and on the top we're way underdeveloped. So that was part of the problem, and that it was constantly pulling on that point, and that's when I had all that resting pain. And that's the thing I noticed the most when I stretched, and I actually did it my due diligence with that stretching, was the resting pain went away first. And also, to speak to your point as well, he had me do those exact same exercises, and it was hard because he said 10 pounds for 10 reps a few times, and I'm like, are you kidding me, doc? I'm not gonna feel that.
Right?
And he's like, yeah, you're not supposed to feel it, okay? Like, I can only imagine what it's like to work with us.
Yeah.
The point is no pain. The goal is no pain, and that includes and performing the therapeutic exercises.
Yeah, see, that's tough for us because any arm wrestler is used to walking around in pain basically 24/7, and that's sort of something we've learned to deal with. And so sometimes there's, the kind of normal pain that's associated with a sport that has as much torque in it as ours does, and then there's abnormal pain, and sometimes we mask it, either subconsciously or intentionally, and end up ignoring it, like John did and I have done, and probably most of us have done. And, then you end up with what's happened to me, lefty, is that, I started with the elbow pain that we were just talking about a minute ago, and then, I got wrist pain because I was trying to protect my elbow. I ended up hurting my wrist, and then finally I sprained my finger all in the same hand because, I'm subconsciously trying to protect joints, and what I'm actually doing is putting my other joints in danger because I'm not reducing the load.
Absolutely. You're changing your biomechanics to subconsciously do that and creating more problems.
Yeah, so looking back, it all makes a lot of sense now. But
I'm glad we could be here for you, Josh.
Oh my God, these questions are coming in fast and furious now. Let's see. About the elbow we were talking about, so what would be some other possibilities for elbow pain outside of the medial epicondylitis? Are there other things that, could be going on that, the therapies you just demonstrated might not work for? Or are there other things that people can try?
Absolutely. So I had mentioned a little bit earlier about that instability at the elbow, some ligamentous instability. So certainly these things won't work if there is underlying inherent ligamentous instability. There also can be some nerve compression. I mean, like you were talking about, John, you are so overdeveloped in those wrist flexors in the forearm that you can get some compression of nerves, usually the ulnar nerve, sometimes the median nerve. And so you could be getting some elbow pain from some ulnar nerve compression at the elbow as well.
Pronator teres.
Yep, some pronator teres compression, usually of a nerve in your arm as well. So you could try some gentle nerve glides. To be pretty unspecific, you can try a general nerve glide for all three of the muscles in the upper extremity. Mm-hmm. I'll have Lisa demonstrate. We'll do the baseline one. So you bring your elbow to about shoulder height, and you're going to extend your fingers and your wrist. You're going to turn the palm of your hand out, and you're going to slowly straighten your elbow just until you feel a little bit of a stretch. And then you can come back to the starting position. So bend elbow, extend the hand, extend the fingers, the wrist, turn the fingers out, and slowly straighten that elbow. And you just go to a point where you feel some of your symptoms in your arm. You can do 5-7 repetitions. This one you want to be a little bit careful with, because if it really is nerve tissue that's irritated, you can make yourself a lot worse. More is not better with that exercise. Okay. So maxing out at about 10 repetitions of a nerve glide are pretty good. Yeah,
when I was seeing you guys, I was talking to Dave, who's another person you have in your office, and he said the same thing to me when he was showing me the radial nerve glide, to not overdo it, to really just stick with, he told me 7 to 10 repetitions once a day and leave it at that. And I mean, we were talking, there's another question coming up about, well, actually, I was just asking right now about the which for me was a radial nerve. I had it manifested in tingling in my, my thumb and index finger. And Dave Shea is having the same issue. He's feeling tingling here, and I just mentioned to him that one possibility because exact symptoms occurred to me, so it could be a radial nerve. And the nerve glide that Dave showed me it worked amazingly quickly. I think it was about 8 days. I went from pretty severe tingling all day long to none. So that might be a good one to demonstrate too. And I mean, I don't know if there are other reasons that you'd have that kind of tingling in that area.
Sure,
but
it's originating from your neck, but even if it's originating from your neck, a radial nerve glide is a pretty good option of something to start with. It can be really gentle as long as you don't overdo it. Mm-hmm. And again, this is something for tingling mostly in that thumb. So,
I'm trying to stand.
All right. So this is one where you're going to straighten your elbow, and you're going to turn your hand down. You're going to bend your wrist and slightly extend your arm like this, and then back to the starting position. Mm-hmm. So straighten your elbow. Make sure your shoulder is relaxed as well, that you're not shrugging your shoulder. Turn your palm down. You can even bend your fingers a little bit if you like. And then extend that shoulder. Mm-hmm. So that's just a nice general, gentle radial nerve glide.
And could you explain a little bit like what exactly those motions are doing to the nerve itself?
Absolutely. So if you think of, I usually compare the anatomy of a nerve to you have a drinking straw and you put a string down a drinking straw. You have the string is the nerve itself, and the drinking straw is the nerve sheath on the outside.
Okay.
And what's normally supposed to happen is the string and the straw are supposed to be able to move in opposite directions independently. Sometimes when there's inflammation of nervous tissue, the string starts to adhere to the straw a little bit. Mm-hmm. So when you're stretching that nerve, those two structures don't move in opposite directions without some pain. Mm-hmm. So you're just gently taking that string and straw and gently trying to break those adhesions so that they start moving independently. And that's why you can overdo it and cause some inflammation of that tissue.
Yes, I think when I was doing those stretches, it felt like very little. So I wouldn't expect like some kind of dramatic sensation when you're doing it, but it made an almost immediate difference. I felt different after about 48 hours, and then, as I said, it took about 8 days for it to go away. But I did follow the instructions, and I only did it 10 times a day.
Good.
So it's like,
and if you do feel a strong sensation, it's probably actually a bad thing with the nerve glide. So.
I'm going to combine a couple questions here because they're kind of similar. I'll read them both to you, and you can tell me if you think they should be handled separately or not. The first one I read to you earlier, and I'll read it now. So whenever I do a rising movement with my wrist only and reach the end of the range of motion, I get a sharp pain in the red area highlighted in the picture, which is this area of his wrist. And when he flexes his index finger all the way and pushes on it a little bit, he gets a sharp pain in the metacarpophalangeal joint. I hope I pronounced that right.
Whoa.
And he says, I think these two problems are related. Do you have any idea of the cause and how it can be fixed? Why don't you just deal with that one, and then I'll read the second one.
Actually, with some of the descriptions that person, sorry, I don't remember their name, that person sent in.
That was Andre Kosmin.
Andre, all right. So, Andre, we do worry, especially with the location of your wrist pain, about some instability in your wrist and potentially ligamentous tears. So that's actually something I would probably recommend seeing a physician and getting some imaging done.
You hear that, Andre? Go to the doctor.
Just to rule that out.
Yeah.
And because of where the tendons in your fingers, the anatomy where that tendon runs, you're probably right. It is related, but we definitely do want to rule out some ligamentous instability.
Okay, so a similar...
That's not super helpful, but...
No. The reason that we have you guys on here is because you know what you're talking about. And as we mentioned earlier, arm wrestlers aren't necessarily smart about their physical health, and sometimes they need to be told, go to the doctor. And so that's definitely good advice.
We're the same way if it makes you feel any better. So it's human nature.
So I think this is somewhat related. So this is from Dalton. He says he has an injury on his forearm, and it happened in a match when his hand was over-supinated and he felt some pops. It hurts really bad to do a hammer curl, which is when you hold weights and do it like that, on his forearm, and he also feels a pop or clicking feeling in the same spot when he pronates.
All right. So, and do we think we're talking about here, some pain in through here? Did he draw a picture or anything?
I'll ask some questions while you'll talk. I'll see if I get some more information from him.
Okay. So there is a piece of fascia or tissue that attaches the two bones in your forearm. It runs in between there. And sometimes if you're doing a lot of rotational movements with a lot of force, you can tear or irritate that tissue, that piece of fascia. So we want to be cautious of that. I guess some of the questions I would maybe have is the clicking that he feels when he's lifting, is the clicking painful, or is it just a pop and a click?
Okay, so he says it's towards his elbow, first of all.
Towards his elbow, okay.
And we'll see if he answers your question about pain.
Yeah, and just so you know, I can kind of visualize what he's talking about.
Okay.
When we get turned in sometimes into that hook, sometimes we get turned under, a little too far, and I think that's where his elbow pain is coming from, or the elbow sound is coming from. And the hammer curls and where he's pronating is when he's neutral, and then he's pronating outwards. He's having that noise and that clicking. So it probably came from being turned to palm up. You know what I mean?
Yep.
So if that helps at all.
So that does sort of make me think that it maybe is that membrane in between those two bones in your forearm, the ulna and the radius. And the way to make that better is resting and to actually avoid those end ranges of motion. So even if you are doing hammer curls and starting in a neutral position, either not adding in that rotation if you're getting that popping sensation as soon as you're pronating or you're supinating, or at least limiting that range of motion. You can still strengthen, but strengthen through a limited range of motion before you get that pop, especially if that pop is painful. If that pop isn't painful, don't worry about it.
I like that answer.
If it's not painful, it doesn't count. How's that?
He did just add that it was a click in the muscle on the top of his forearm. So I don't know if it sounds like that's what you're describing anyway. So.
Yep.
All right, cool. So there you go, Dalton. If you need more information, just throw it out here and I'll try to get it on. Okay, I got some questions from Craig and from who else just asked this question? Top row low. All right, so we got two questions about ice. Whether or not you should use it, when you should use it, what do you guys think about it? And also the use of ibuprofen, pro or con, and that sort of thing.
Okay, so I'll start with ice. We have all these fancy modalities in physical therapy that we can use, and ice is by far my favorite. I think it's the most effective. It's, for me, for the most part, it's better than ultrasound, better than TENS, because it really does help target the reason people are often having the pain. So the ice helps decrease the inflammation, which then in turn decreases pain, where some of our other modalities are breaking a pain cycle by masking the pain. So when do you use it? Definitely 48 hours, up to 48 hours after an injury. Even if it's past 48 hours after you've had the injury, if you've done anything that you think has irritated that injury a little bit more or flared it up, still use ice, So if you've gone back to the gym and worked those same muscle groups, still use ice. When you use heat these are all pretty general rules. And a good time to use heat is if you really haven't done anything, if you have rested for 48 hours and you wake up in the morning and things feel really stiff, and you need some increased blood flow, that's when you use heat. The only exception to that, not the only, one of the big exceptions to that is that nerve pain we were talking about. Sometimes if your pain really is primarily nerve pain, ice can flare it up and make everything a little bit more painful.
Interesting.
And just a note on the duration of time that you should be using that modality in. Don't put the ice pack on and sit down and binge watch Game of Thrones or whatever you're into, or go to bed with that ice pack on. So the body will have a response after about 10 to 15 minutes of those tissues being cooled, where if it gets to a certain level, in order to protect itself, the body will open up the capillaries and flood the area with blood and fluid to try to protect it from hypothermia, and you can actually aggravate that inflammation and make it worse. So no more than about 10 minutes on an ice pack, and then give the tissue a couple of hours to warm back up before you do it again.
Okay, good advice.
Yeah.
This question is semi-related. It's from John Cervantes up in Maine. What's going on, John? He wants to know what you guys think about topical analgesics, whether they're worth it or not.
I think if they help, then use them.
If it makes you happy.
So they work on a theory, sort of, it's called a gate theory for pain, meaning you're blocking your pain receptors with a different stimulus than pain itself. So just like if you hit your funny bone, if you hit your ulnar nerve and it hurts and you do this to make it feel better, the reason that feels better is you're stimulating those sensory receptors with a different stimulus. That's the same thing as some of those topical medications, what they do. And that's perfectly fine to break that pain cycle. There's nothing necessarily wrong with that. And definitely if it helps you break that pain cycle, then go ahead and use them. Sort of going back to what Lisa was saying, be careful if you are using those. You actually definitely want to watch how long you're keeping ice or heat on that area, because you can't feel quite as well, and so you could be burning yourself with heat or burning yourself with the ice and not actually realize it. So
Okay.
That actually happened to me once when I put too much of it was like a super version of Tiger Balm one of my buddies made back when I was doing a lot of martial arts, and he put it on, and I was sitting around, and then I was like, Jesus Christ, like my hand was, I felt like it was on fire. And I washed it off, and I mean, my friend actually made himself blister. I didn't get to quite to that point, but I mean, so I have I like them, but I'm not sure about what they really do other than make you feel warm.
yeah, this is true.
So, I don't know. Anyway, that was one of the questions. So, okay, let's see what else we got.
That's a good one.
All right, here's one a little bit different. Do you have any suggestions for strengthening the subscapularis?
Oh, I love the subscapularis, actually. Sure. Okay, so there's
Who
actually...
doesn't?
So when you strengthen subscap, you actually want to think about it as two different muscles. Subscapularis runs on the undersurface of the shoulder blade, if any people don't know. And because the shoulder blade is sort of a triangular shaped bone, subscapularis has a bunch of different muscle fibers, and you want to think about strengthening the lower subscapularis fibers as well as the upper subscapularis fibers. So thinking of it as two different muscles instead of just one. So let's see, what sort of things do I like for subscap? I actually like just general internal rotation, whether it's with a cable or a TheraBand, and doing that in different degrees of range of motion. I have a TheraBand, hang on. You can do this with cables at the gym though too. So working internal rotation actually down at your side to get lower subscapularis.
Mm-hmm.
And then to get upper subscap. Woo! No, sorry, I was giving you slack. Let me see here.
There we go.
There we go.
Oh, okay.
At 90 degrees like that. And you can even do it in like a 45-degree angle as well.
Okay.
That's cool.
Yeah. You can also do, what do you like for subscap?
We do a lot of that. We also do a lot of weighted from a sideline position.
Mm-hmm.
I don't even know how I would demonstrate that.
Hold on.
Please hold.
Oh, we do have we do have a weight.
Yours are probably not small and purple like ours are. But
You'd be surprised.
And this is
I don't know if I want to know that. If you're sideline, down where your shoulder is supported, and from here.
Okay.
Okay. So getting that stability when you're resting on your side, scapula being stabilized, the shoulder being stabilized, sometimes you can work through a different range of motion and more specifically isolate that muscle than when you're looking at here in an unsupported position where you have to engage all the stabilizers as well.
That makes a lot of sense. And what would the rep range be for that, you think, as far as like a rebuilding kind of a modality, as far as like, trying to rebuild an injury or even just as rehab?
So for rehab, we usually think about, again, lighter weight, higher repetition. We always use 3 sets of 10. I don't know why that's the magical number, but it sort of is. Definitely for strength training. If you're not injured and it's not painful, I mean, you guys tell me what you do, but we usually do either reps of, 12, 10, and 8, or 10, 8, and 6, increasing the weight for the last 2 sets. That first set is usually a lighter weight and is a warm-up set. Is that similar to what you guys do in your strength training?
Well, everybody trains. That's one of the reasons we have this show, is to discuss all the different manners of training that people use. But that is definitely a pretty standard practice, descending sets with increasing weight. So, yeah, that makes sense.
Yeah, and a lot of us, myself anyway, I train that on the table. So I'm using all that pressure, and it's mostly static. So it's mostly holding, and someone's resisting that. And then everything else I do beyond that is higher rep, lower weight, in order to get some blood flow going, range of motion. Because all of this, staying super, super tight, I've learned over the years, your joints don't like that. They like to be open, and you get these injuries where, like, my left arm straightens, and that's as far as my right arm straightens. That's it, So we've been trying to learn more, like, how to make it so that doesn't keep happening.
Yeah. Well, you're working on your King's move. In 10 more years, you're going to have a nasty King's move.
Yeah, it's going to be great.
They don't know what I'm talking about right
I have no idea.
Don't worry about it.
A King's move is when your elbow locks like John's does, and some people will lock even a little bit more like that. They basically will lay down their tricep on the pad and then lean back, and because their arm doesn't straighten, they basically wear people out.
That's cheating.
A lot of people feel that way. So you picked up on that pretty quickly. But a related question from Gregory on this subject, since you brought up the training on the table, John, is what do you think about using arm wrestling as a recovery exercise in general for all these different injuries we're talking about? Devin Larratt, who's one of the best in the world at his weight class, 225 right now, he basically trains on the table almost every day, and he uses it to train through injuries. He just changes the intensity and the force that he uses, but he basically espouses a philosophy that using the active arm wrestling motion as a recovery technique helps injuries heal faster. What do you think?
So with what you were describing is with that theory that if he's injured and he's decreasing the intensity, but he's still
going through
that same motion
that caused the injury.
Yeah, that's actually the same idea of sort of what we do in physical therapy is low load, high repetition. As long as it really is that lower load, that's the key.
Right.
Then that actually makes a lot of sense to me.
Yeah.
I don't know how you control the load in arm wrestling. How
you'd have to have very good training partners.
Yeah.
Basically, instead of using your bands, using your cables, dumbbells, you'd have a human being. So if you have a very controlled and good training partner, I've actually used that theory myself, and I can say if you are willing to point out like, okay, this guy might not be best for that, but this guy is. It's just smooth, and it's the same exact motion that maybe you did injure it in, which really, in theory, is what we're talking about, right?
Yep, exactly.
I think it's valuable, though, to maybe back up a step and find out if that injury was caused by an imbalance somewhere. There are a lot of synergies in arm wrestling, right? You're not just using a single muscle all the time. You're using a bunch of muscles in combination. And that injury may have been caused by an imbalance on the other side of the joint, or maybe the antagonist is a little bit weaker, and so you have some movement compensations that are putting excessive force on a joint or a muscle. So then going back and not necessarily training the same motion over and over again, but balancing that with strengthening that imbalance, that will help as well. So
we've had a few conversations. I know I have personally, and we have had a couple times on this show where we do a lot of pulling motions. There's a lot of rowing, strength, that kind of thing, and always the conversation becomes like, well, how much pushing exercises do we do? And usually it's a lot less, and that kind of speaks to that point of imbalances, our triceps and sometimes our front delts and the whatever the muscles that you're called that actually put your wrist back. We typically don't do anything with, there you go. We don't do anything with our wrists past that most of the time. So we train this. We don't really train any of the openings or any of the, like you said, stretching is something that gets overlooked. It's pretty much non-existent in this sport.
Until you're injured.
Yes.
Until we're injured. Yep. All right. I've been neglecting these YouTube guys. They always have interesting questions. I don't even know what this guy's asking about, but I'm going to ask you. Do you have an opinion on prolotherapy and when or if it should be used?
I do not have a good opinion.
I asked him what it was, and he says it's when you basically inject a sugar solution into a joint to help heal the area.
I believe it's actually dextrose, I believe. Might be wrong.
So is that something you guys are familiar with? Or?
So I've heard of prolotherapy. I have a general idea of what it is. I'm not educated enough on it to have a good opinion, to be totally honest.
Fair enough.
But
it sounds interesting.
It does sound interesting.
Yeah, from what I understand, and it's probably even less than what you understand, is probably what you just said. But I believe you inject, like you said, a sugar solution. I think it's dextrose, and it basically irritates the area in order to get the immune system to pay attention to it. I believe
with an inflammatory response.
I believe that is what the basic theory behind it is. Yeah. Sounds painful. People go back and forth about cortisone shots, and they basically don't seem to do anything except maybe provide either a placebo effect or some kind of mental strength because you think you've got some kind of magic potion injected into your elbow. But most of the time, it seems when people do things like that, it doesn't end up working. But I am not familiar with this. I'm going to look it up because I'm curious about it. All right, so that was one question. Let's see what else these guys have on here. Do you have a reference? This is from Craig Ruiz. Is there a reference that you would recommend for doing active release therapy on yourself? Is there a book out there or a website or something?
You actually might know that better, Josh. Do you have a good reference?
I was thinking about it. The answer is no. I did have one. I have a book somewhere, Craig, which I can try to look up that had lots of stuff in it, and if I can find it, I will share the title with you, but it's buried with all my other massage books somewhere.
Yeah, I don't have a good reference off the top of my head or resource, but
Or, go see your physical therapist and they will teach you
how to
There you
do
go.
it. There's a plug.
Here's a question from Philippe, who's an up-and-coming young arm wrestler. He wants to know, maybe not a good question, he says, but is it possible to make tendons thicker, and if so, how?
Well, it is possible, but I think probably not in the way you're thinking. This is a good question. This isn't a bad question. So when we think of thickened tendons, it really is a chronic inflammatory response. And so what happens, I'm going to bring back Achilles tendons again, just because they're kind of superficial. People can see them a lot, see them really well. Sometimes you'll see people with these really thickened Achilles tendons, one side maybe more than the other. It's actually doesn't necessarily mean the tendon is stronger. It means it's bigger and it's thicker. But if we were really to take a biopsy of a tendon that did have tendinosis, and that's what that's called, and we looked at it underneath a microscope, instead of all those fibers lining up nice and straight next to each other, they're laid down haphazardly.
Right.
And so that doesn't actually make that tendon stronger. It makes it more functional. It makes it weaker. So you could make it bigger and thicker, but if your goal is to make it stronger, you actually don't want to do that.
So what you're saying basically is by having the fibers like this instead of nice and laid flat, there's a bigger risk of tear.
Absolutely.
Exactly.
Right. Don't want that. We don't want that.
Yeah, we don't want that. Well, one of my friends, Mike Shalhoub, who's an amazing 54-pound puller, he's getting a tendon replaced in his left arm, and they're going to use one from his leg, and he told the doctor, take the biggest one that you can. And the doctor basically said the same thing to him, is the bigger tendon is not necessarily going to make you stronger there. It's not going to necessarily give you more resistance when you bend your wrist. So he basically said the same thing you guys said.
Yeah.
Here's a question from Mike about, do you recommend TENS devices? I know you mentioned them earlier when you were talking about ice, but he's just curious about what do you think their effectiveness is?
Sure. They do seem to work really well for some people. So again, it works on that gate theory for pain. You're blocking the pain receptors with a different stimulus. And based on that theory, what's supposed to happen is your pain is supposed to decrease while the TENS unit is on. So for some people, there is a continued effect, and that when they take the TENS unit off or turn it off, they have a continuation of that decreased pain. Why that happens, we don't really know. But especially if your pain isn't biomechanical and there isn't a specific structure that you can identify that's causing your pain, and it tends to be a little bit more of a generalized pain, a TENS unit is a great way to sort of break that pain cycle.
It's something a lot of people use, and we hear about, e-stim and stuff like that, and people buy machines and have them at their house and set themselves up with them, and like you said, Lisa, binge watch Game of Thrones while they have these electrical devices attached to their body. And I've spent a good amount of time looking them up because, my hero Bruce Lee used to use them, so I was like, it must work then if Bruce Lee used it. But it doesn't seem like there's really a whole lot of evidence indicating that they really do much. I mean, is that accurate? Other than what you're saying?
There isn't a whole lot of evidence that if it's at a sensory level, so you're not getting a muscle contraction.
Right.
There isn't a whole lot of evidence that shows there's continued effects for using TENS, except for when you have it on. So when people who do have chronic pain and there isn't anything biomechanical that you can identify that's causing that pain, it is a way for them to control the pain without using medication. But if there is a specific structure or something biomechanical that is causing your pain,
it's not going to fix that.
It's not going to fix that. Yeah, exactly.
Fair enough. Well, there's a lot. I mean, like any sport, we're always looking at. I was at a conference at one of the national championships, and there was this guy selling something that basically was like a floor buffer that he had made a little bit smaller and put a special pad on so you could like zip it all around your arm. I was like, man, I really felt good for 5 or 10 minutes afterwards, but I mean, it's one of those things. It's like, is this a placebo effect? I mean, what am I doing? Because I'm literally holding like a floor buffer on my elbow. I was like, anyway. So
5 to 10 minutes of relief. So take it for what it's worth.
That's exactly what it did. Okay, a couple more questions here. Jonathan wants you to know, first of all, that he's up and coming and single.
Oh.
And what do you think about?
Check your URL, Jonathan.
I'm giving him a little bit of a hard time. He actually has a big event coming up because he's got a challenge match going on as his first event as a pro. He's basically taking on all comers, and anybody who beats him gets $100, if memory serves, at a Travis Bajan event. So
yeah, I know, right?
we'll keep you posted. And he's asking about cryotherapy, whether it's valid or not. He might be trying to think ahead of after he does that challenge match, how he's going to feel. He might need to get into a science fiction chamber and freeze himself so he'll feel better.
Yeah.
But what about cryotherapy? Is there any legitimacy to it or what?
So if we're talking about cryotherapy, is not just icing and colds, but sort of this new fad of like cryotherapy rooms or capsules.
Yeah, I think that's what we're talking about. Yeah,
I think that's sort of where we're. Yeah. Again, I know what they are. I've seen them on TV. I don't know enough about them to have a really good educated opinion on them. Do you know of anyone who's used them? Or
I don't know, but I have seen them on TV.
Yeah.
I think it's another one of those things where you're looking at taking a localized effect to a systemic level, and it may be another one of those. If it makes you happy, we'll have to learn more about it and get back to you.
Fair enough. David Lopez has a question about what he's describing as loss of blood flow to the hands that he's been noticing recently, and if there are any techniques to alleviate this symptom. So I'm assuming you're talking about loss of feeling, David. So that could be the nerve stuff we talked about earlier. Is there other things that might cause those kinds of sensations, you guys?
Well, I guess some of the questions I would have is what part of your hand are you experiencing the loss of blood flow?
Mm-hmm.
Is it sort of your fingertips? Are you really feeling it, the loss of blood flow into certain fingers, which is a definite possibility, especially maybe with some carpal tunnel syndrome, some extreme carpal tunnel syndrome. There is a nerve that runs through the carpal tunnel, but there's also veins and arteries that run through there, and you can actually have loss of blood flow to certain parts of the hand, and I would definitely see a physician about that.
Yeah.
That can be relatively dangerous. So.
I know that. Just on the people that I work on as a body work, I frequently have people come in who have, lack of sensation in hands and feet that they've had their whole life.
Yeah.
It's just like a congenital issue. But and with arm wrestlers, it's something that, we make everything worse. So, if you've had that before, all of the work we're doing, and whether it's just muscles compressing nerves or whether it's something more serious, it's a very frequent complaint that we have. What is your opinion about massage in general, like deep tissue and that kind of stuff? Is it, most of the research that I always quote indicates that it is, more effective for muscles than it is for tendons and ligaments, that kind of stuff. But do you feel like that's an important part of a recovery program?
Absolutely. We'll recommend. We often do some sort of manual therapy or massage to specific muscles. But absolutely, I think massage therapy in general is a great way to increase some blood flow and get rid of some of those toxins in the muscles that build up after working out. What is your opinion?
And also, we use a lot of soft tissue, deep tissue, trigger point release, and myofascial release. So if muscle fibers tend to bunch up and cause painful adhesions or knots or restrictions, massage is a really useful tool for alleviating a lot of those limitations as well.
Actually, that reminds me of something you did to me, Lisa, when I saw you once. We used that little metal, basically scraping device on my forearm. What is that, and what is it doing?
So it's basically using an instrument to manipulate the soft tissue. Megan was talking about adhesions before. So you have your tissues that line up and layer, and they're supposed to move freely along each other. And sometimes when there's any kind of stress or strain or even trauma or overuse or anything to those tissues, those layers can kind of stick together. They don't move very freely. They can cause a lot of pain. Mm-hmm. So we use that tool to help break up those adhesions, to get the layers of tissue to flow more freely over each other and reduce some of those limitations.
Okay. So if somebody was going to try doing stuff like that at home, how often should it be done? Is that something you want to do sporadically versus every day?
Well, when you say try at home, are you talking about
I'm talking about
grabbing a spoon out of your kitchen drawer?
It's exactly what I'm talking about. I think I may have mentioned this to you when I was in there, that it was shown to me in my bodywork course, many moons ago, except it was using a literal spoon, and it was called spooning. And that's basically what it did. It just, scraped areas. I think it was a more of a haphazard approach than, the medically specific way that you're using it. But I mean, it is obviously you're doing some amount of soft tissue damage when you're doing it. I mean, it's not extremely deep, but I would assume that's not something you want to repeat daily.
No, so you'll notice that once we did that, you'll get some redness in the skin. You'll get what we call petechiae, which is a breaking of the surface capillaries, and you get that redness, those purple spots, almost red spots on your skin. So we're causing some damage to those capillaries. We're causing an inflammatory response that brings in all of those chemicals and nutrients that cause healing. And that's definitely something that you want to allow to happen over the course of a few days before you go back and attack it again.
Okay. Anyway, it feels very interesting. I love the variety of techniques that you guys use. It feels like there's, as the years have gone by, our approach to injuries like this has gotten much more refined and sophisticated, and I feel like you guys know this already, obviously, but I mean, when people used to get ACL surgery, it was a couple of years before they would be back to normal, and now some people are back and, back on the field of whatever sport they play after 6 months. So I think that the techniques in general are much more refined, and I think that it's helpful. I mean, we've already said 65 times, are not necessarily that bright when it comes to dealing with our injuries. And I mean, I know I'm getting a lot of comments as you guys are talking about how helpful and amazing this is. I mean, a lot of these guys don't necessarily have, as I mentioned to Lisa when I was at your office yesterday, that a lot of these guys, don't necessarily have health insurance or access to physicians or physical therapists on a regular basis. I think the information you're giving them is very much appreciated. So I wanted to pass that along.
Yeah, for sure.
Good. I hope so. And hopefully a little bit of it helps. And certainly if it's not helpful for your injury, or definitely if it makes it worse, please, at least see your primary care
yes.
and start there.
I will make sure I end the show with the same disclaimer I started with, because like I said, some of us can be stupid sometimes and we don't go to the doctor when we should. So this talking about hands, and I got a couple of questions, one from Daniel and one from Craig, about are there additional exercises or motions for nerve relief specific to the hands? And Craig is also basically asking the same thing. He says he notices it's his ring finger and pinky that go numb. And so that would be, is that still the radial nerve if it's down that end of the hand, or is that something?
That's ulnar nerve.
Okay. So that was the first technique you showed, right?
So you can do that general one. I'll do it on my left hand, like this. If you really do want to start with that one, especially with the ulnar nerve. Start with that, doing that one for a couple of days, and then if you really do want to do a glide for the ulnar nerve, the way you isolate that, the only way I can sort of describe it is like upside down goggles. Okay. So if you take your hands like this and your pointer finger and your thumb and flip your hands upside down like this, you're actually gliding the ulnar nerve. Okay, ready? Yep. There you go.
We should all do it, right?
All of you guys could
oh my God, that's hard.
Before you start arm wrestling, and now forget it.
In yoga class, I can never do anything.
Yeah.
Even though
my range of motion's not good enough, guys.
I
It's a little bit of a party trick, too.
This is a group activity, so I can hardly do it. Oh my God.
Yeah. So probably for some other reasons, some tightness other places. But yeah, just until you get a little bit of a stretch of that ulnar nerve down that outside aspect of your arm and into these two fingers.
When she says until you get a stretch, you want to go until you feel the tingle.
Yep.
And no further than that.
Okay, that's a good tip. Good tip. So Dalton, who we were trying to help earlier, when he was talking about his forearm pain, he just chimed back in and saying that the pain is in his brachioradialis. I don't know if you just went to look that up. If you did, good work, man.
Yeah, good.
So the pain is in the brachioradialis area of the forearm, and it's felt when he's pronating and rising. So I remember the advice you gave him before. Is that still what you would say? Or is there anything else he could do for that?
He could, we were just talking about massage therapy or manual release. He could sort of get into that area, isolate the belly of that brachioradialis, and do some soft tissue work. So when I mean work, have you guys covered this before? Have you done this, Josh?
Yes, I have.
Okay, all right. So just getting on that muscle belly, you can use a little bit of lotion, using your thumb, digging down into that muscle belly.
Yeah,
Good.
I do that to arm wrestlers frequently. I use my elbow, my forearm, so they scream like little children. But it really feels horrible when it's being done, and it feels amazing when it's over.
Yes.
But people will accept it because they know what it's going to feel like afterwards. It's almost like your arm feels, for lack of a better term, freer. Like you're saying, the adhesions have been broken up or what have you, so that just your arm feels lighter, it feels freer, it feels like the motion is more...
Greater range of motion, suddenly you straighten your elbow, it's great.
Right.
Maybe someday.
Yeah, another thing about arm wrestles, a lot of them are like have an aversion to like massage or any kind of like something they might view as pampering or stuff like that, so they all walk around in pain and whining instead of going to see someone getting fixed. But that's on them, man.
Yeah, right. Massage isn't always like this nice, fluffy.
No,
nobody ever describes my massage as fluffy or nice. They mostly just yell at me and threaten to hit me.
Yep. That means you're doing something, right?
Yeah.
So Corey saying he can't do the goggles at all. So this is like a theme.
Start with that baseline one. Elbow, shoulder height, straightening the elbow.
Oh, yes. Okay, so people are just being funny right now. Again, people are saying your shows, this is amazing. It's very helpful. All right, let me see. If you guys have any more questions before we let these two women get on with their lives, give people a few more minutes to try and answer last-minute questions. We've covered a lot.
Yeah.
And let me see. I feel like I missed somebody's question here. There was another question about elbows, and it's so much stuff there, I'll never find it again. But I guess I would like to ask another question about the elbow. I'm trying to figure out a way to put it. That's the most common complaint that we always have. I mean, every one of us at one point or another blows this tendon out, either an actual tear or just has pervasive soreness that lasts for 6 months or a year.
Forever.
Can you guys think of anything else that people could do? I mean, are there any techniques that you haven't shown yet that might help, just that in general deal with that kind of pain or tightness?
Pain or tightness?
I'm just saying, there's so many different complaints about the elbow, and the basic stuff that you've shown, which is already going to be greatly helping a lot of us. I'm just wondering if there's any other tools you guys have in your box that you break out only in cases of emergency, because
I don't know about any additional tools in the toolbox, but maybe reiterating, the value of rest. I know, especially when you're training for a competition, that mentally can probably be a little bit disturbing. But even 48 hours of rest is something that should definitely be considered. If you can decrease that pain, it means then you can train harder the next few days afterwards. So it really, stopping that initial inflammatory response and not letting it get to a point where it becomes subacute or a little bit more chronic.
Let's talk about that idea of rest a little bit more. When I pulled my pulley tendon in my ring finger, my left hand, I basically did nothing with it for a month. So and then I started to do light exercises with it, and I didn't start climbing again because that's how I injured it, climbing, for another full month. So I basically rested completely for 1 month, and then did only light stuff without actual climbing for an additional month, and then I went back to climbing, which was advice that was given to me in the climbing book that I had, and was reiterated by a lot of people that climb over at my gym. So in terms of arm wrestling, when we rest, most of us are like, okay, I rested for a day, that's enough. Or I rested for 48 hours, now I want to go back and compete. But how long should we really be leaving things alone? I mean, we worry about, like, I'm going to lose strength, I'm going to lose technique, I'm going to lose whatever. So we try to rest, whatever the minimum amount that we think we can get away with. But, for something like your elbow, if it's been hurting for 6 months, is it advisable for us to just stop until the pain goes away completely?
You want to address that?
You don't want to stop until the pain goes away completely. And I know that's going to be an answer that everyone embraces because, and the caveat to that is the pain is never going to go away completely. It can get better, but until you stop doing what you're doing, you're always going to have that constant mechanism of injury over and over and over and over again. So you can rehab it, you can allow it to heal, you can back off when it's acute, you can change the intensity with which you train, but if you wait until that pain goes away completely, it may be a year or so before you go back to doing what you're doing. And that's, I know as a runner and the things that I do, if somebody told me I had to sit down and not do that for a year until my ankle feels better, well, that's just, you're going to have to bring me to someone else who's going to give me a different answer. But backing up and, like Megan was saying, allowing that time for rest and recovery and mixing it up a little bit. And Josh, you and I talked about this somewhat too, is looking for those imbalances. So it's such a critical and essential thing, specificity of training, right? You do this, so let's always do this, always do this, always do this. But you have to understand as well that you spend a lot of time in these isometric holds, right? You never do anything past this unless maybe you're training here, or you're in a losing position, or you're in a tournament where you're pulling against somebody who's a little bit stronger than you are, and you're being pushed more into a position that you're not used to training over and over and over again. So both sides of the joint need to be strong. You can push all day long, but you also need to be able to stop that force. You need to decelerate, you need to absorb it, you need to return it, and you need to be able to hold. So if you're just constantly working pronation, 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 not only are you more likely to injure it, but you're just not going to be as powerful on the table as
that
well.
Makes sense.
So,
makes a lot of sense.
Yeah, that makes perfect sense.
Way off track of the original question.
Well, it was a meandering question to begin with. So, how about you, John? Anything else you want to ask these two experts while we have them all to ourselves?
I don't know if I have another question to ask, but I just think it's really been reinforcing that. Also, another point that maybe we haven't really made yet is that a lot of this stuff can be done before you're hurt, and that's what I've learned over the last couple of years, especially after I got that first bad injury where I don't want to say I learned my lesson, but I at least half learned my lesson. So now I do a lot of these recovery work, a lot of rehab work. It's boring. It's not fun. It's monotonous, but when you're not hurt, you'll thank yourself, you know. And you have to kind of, I think, in our sport, and in most sports, but in this sport where we're always a little injured somewhere, sometimes you have to be really thankful that you're not injured. And it takes a lot of work to become not injured sometimes. And when you talk about training, and we talk about training, where for me personally, that's max effort, 5 days a week on the table. But it's harder for me to do this rehab work. That's harder training for me because it's controlled, it's super specific, it's super focused, and I don't feel like I'm building anything. But it's helping me build something later. So I think, all this advice for when you're injured can really, really pay off when you're not. So I think it's important to start this kind of thing when you're not hurt so that you can continue to be, you have a good foundation to not get injured in the first place. So, but I think it's been really reinforcing as far as the things that you've said and, the methods that you're bringing to us. They're things that everybody can do. So I think that's a good thing too. And I really thank you guys. It's been a lot of fun, and it's definitely, I've learned a lot. So that's always good too. We appreciate it.
Good.
Thanks for having us.
Yeah, you guys, this is an amazing show. I think it was probably the most informative show we've done. I mean, we talk about training a lot ad nauseum, frankly. We've done 37 episodes about how to be a better arm wrestler. And this is the first time we finally came around to talk to people that actually might know how to keep us from getting injured and keep us healthy, which, as John just said in his own meandering answer, is not something that we think about enough. So,
for sure.
Again, I want to pass on the thanks for everybody on Facebook and YouTube who's giving you guys a lot of love because, again, they don't have necessarily the exposure to this kind of stuff that we should here in the United States. But anyway, it's been awesome. You guys have been amazing. And once again, go see a doctor. Go see a physical therapist if you are hurt. Don't just do
it at Tufts Medical Center.
Yes,
there you go.
See them at Tufts Medical Center. That's right. Right here in Boston, Massachusetts. We should be coming for the New England Arm Wrestling Championships in 3 weeks anyway.
I'll be there.
Stop by and see Megan and Lisa at Tufts.
All right, thanks, guys.
Thanks very much. You were awesome.
Have a good night.
Good night.